Good morning and welcome to the Clinical Associates Screening, Brief Intervention, and Referral to Treatment SBIRT training for medical assistants. This is being recorded in April of 2022. The objectives for this training are at the end of this SBIRT training, participants will be able to describe what SBIRT is, describe how SBIRT is conducted in your practice at Clinical Associates, and describe where to document the screening results and how to label encounters, which are functions that are required as part of the SBIRT process for medical assistants. So to begin, we want to set the groundwork for what SBIRT is. So SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. And the screening component is foundational, and it is the function that as a medical assistant, you are responsible for completing or ensuring is completed by the patient. And so the screening is really, as it says here, a simple test to understand a person's substance use behavior. So using validated questions like the Audit C and the 2 drug questions that are part of the tools within your electronic medical record, you are able to understand what a person's substance use behavior looks like. And it's similar to screenings that may be done for other health disorders to be able to understand what somebody's behavior looks like and what the level of risk is then to their health associated with that behavior. A brief intervention is the second part of the SBIRT framework. It is a component that at Clinical Associates is performed by the provider. But we are discussing it here so that you have a brief understanding of what it is and that it is part of the process. So, for patients who have some type of moderate or high risk substance use behavior identified, the brief intervention is an opportunity for a conversation between the provider and the patient related to thinking of it as a health education conversation. So it's an opportunity to talk about their screening results, discuss the risk associated with that behavior as it applies to their health, and a discussion about the patient's perspective related to their substance use, and if they have any readiness to change their behavior. For some patients, it's also an opportunity for those patients that have a positive screening result and have a readiness to change and feel like as part of that change process, they need some assistance. It's an opportunity to refer them for additional assistance. This is not as common within the primary care setting. However, it is an important component for those patients when ready and necessary. So now that we've level set on what SBIRT is, we're going to take an opportunity to talk about what this has looked like within your practice, in the past based on some of the available data, but also talk about the workflow to ensure that everybody moving forward is comfortable with their role and responsibility in the SBIRT process. So SBIRT was initially implemented in July of 2021, and we have data to support on the next slides through July through December, and SBIRT has continued, and we've been able to reevaluate where the screening, brief intervention, and referral to treatment processes stand, and are using this training as an opportunity to inform staff to ensure that everybody's comfortable with their roles moving forward. So this dashboard that you are looking at now does represent, again, data for the period of July 2021 through December of 2021, and is comprehensive of all Clinical Associate sites. So it's aggregated numbers. And so we can see here for screening, the goal is to achieve at least a 75% screening rate. And the 75% screening rate, the desire there is to really demonstrate that the workflow is integrated into your processes. And so anything below that 75% demonstrates that there's still opportunity to better, to better integrate so that it becomes a natural part of the services that are provided to patients. So we can see here, it started really strong in July of 2021 and then fell off pretty systematically over the months until we got to about a 15% screening rate in December. Cumulatively, all sites are at about 34%. The positivity rate, so those patients that are identifying some type of moderate to high risk substance use behavior, falling anywhere from 11 to 16%, which is around the national standard, but demonstrates the value in the screening and talking with patients, as we're seeing these numbers. The brief interventions, so those conversations that providers are responsible or having with patients that demonstrate some type of moderate to high risk substance use behavior, should be at about 60%. We can see here that they're falling below that, and providers are similarly have education and support to improve those numbers. Referral to treatment, not going to spend a lot of time talking about this as part of this training, but just want to note, that it does happen less frequently within primary care, so not always going to achieve that 15% rate. However, I think we know from the cases that have been presenting, they have been referred as necessary. So we're comfortable right now with where that number sits for your practice. The following slides just represent some of the individual data. I'm going to pause on them. You may pause this recording to look at the individual slides if you wish to. First, we have Towson, Woodholm and Pikesville, and then Reisterstown. Each site has an opportunity for growth in the areas of screening and brief interventions. So what is the expectation as it relates to screening? We have noted some discrepancies in when screening occurred and how screening was occurring. So please note here that screening is to occur for all patients age 18 and older at least once per calendar year. So that means that all of your adult patients should be screened at either a well visit, a new patient appointment, or a sick visit. And that's where definitely there was some discrepancies. We were seeing patients, being screened potentially just at well visits and not at sick visits. We do understand, leadership understands that there are times when a patient may be too sick to be screened. There's definitely that little cushion there as we looked at, the previous data. You only have to, screen a minimum of 75%. But the majority of patients should be screened again at any of their once a year at either a sick visit, a wellness visit, or a new patient appointment. And the value of doing that and not just waiting for the wellness visit is that not all patients come back. Many of your adult patients who believe themselves to be well are not presenting for those annual wellness visits. And so it's an opportunity to capture them at any time during their encounter with your organization to evaluate their health, how that substance use is impacting, and then have an opportunity for them to consider change. So if you're working through this workflow, as the medical assistant, you're going to determine if the patient is eligible for screening. If the patient has already received a paper form at the window from a associate, that's fine. As the medical assistant, if the screening needs to be entered, you can then enter the results. Otherwise, you can disregard that form. If the patient has not been screened this year, then you can either, if you are providing them the form, this would be the time when you would either verbally ask them the questions or provide them with the screening form. In any event, you are responsible for making sure that the responses from either their verbal response to your questions or from the screening form, that they are entered into the SBIRT template within NextGen. So just a little information regarding the screening questions. So it is important to ask the questions as they are asked. So for the audit C, that is determining a patient's risk around their alcohol use. And so the first question is, how often do you have a drink containing alcohol? And that is the question you want to ask. You then want to provide them with their potential responses. If you're doing this verbally, if they're looking at the paper, you just want to make sure that they, again, your forms have all of these individual responses. And so you want to say, how often do you have a drink containing alcohol? Your response options are never, monthly or less, 2 to 4 times per month, 2 to 3 times per week, or 4 more times per week. If the patient says never at that point, you would enter that response. And then you would not have to ask the other 2 audit C questions, because you don't need to ask them how much they're drinking when they're drinking if they never drink. However, if they respond anything other than never, you're going to enter that response. And then you are also going to ask them how many drinks containing alcohol do you drink on a typical day when you are drinking. Please note that this is, that typical day when you were drinking was recently added to better reflect how the validated questions are written, and should help clarify that response for patients who were somewhat confused by the previous version. Again, you must read that question to them as it's written and provide them with the responses that are available on this screen. And then lastly, you want to ask them, how often have you had 6 or more drinks on a single occasion in the last year? And again, provide them with the potential responses. What you don't want to do is begin to modify the questions or how you ask the questions. You don't want to start off by saying something like, do you drink? Because those are not the validated questions. And so it doesn't then potentially elicit the responses, as necessary. So always ask the question as written. And then if, again, if the patient says never, you would stop there and move to the drug screening. And if the patient says anything other than never, you're going to ask all 3 questions. Once those questions have been asked, although you are not providing the brief intervention, it is important for you to have a level of understanding about risk, as many of you do help provide your provider with some guidance. Just as you might, if my blood pressure were really high, you would tap the provider and say, hey, we're really concerned about, this patient's blood pressure. Similarly, many of you are doing this as it relates to the interpretation of their SBIRT screening results. And so it's important to know that for your patients that are scoring a 0 to 3 on the audit C, that's considered low risk and there's no intervention necessary from the provider. However, those patients that are scoring moderate risk, meaning that they've scored a 4 to 7 on the audit C, that demonstrates that drinking does have the opportunity of increasing the risk of damaging their health and could lead to serious medical conditions. And so that's considered moderate risk. And your patients that are scoring 8 to 12 on the audit C, it is representative of high risk use, meaning that the drinking has either currently demonstrated a significant risk of health problems, or they, in the future, or they may currently be experiencing difficulties to their health as a direct result of their alcohol use. And so those are patients that you are going to want to inform your provider. Dawn scored a 4 or Dawn scored a 7. And, or Dawn scored a 12, and she's going to need to have a brief intervention. As it relates to the drug questions, similar to the audit C, you do want to ask the drug questions as they are written within your screening tool. So you don't want to just say, do you use drugs? You do want to ask the patient a direct question about their drug use. You do want to record their responses of either yes or no. And any yes does constitute a positive response. And so again, similarly, if you're informing your provider of, things that are risky that you've identified as part of your rooming of the patient, you would want to let them know of this response. And this does include any yeses, even related to marijuana use. So once you have, you've been working through that screening workflow, It's important for you to be comfortable and cognizant of where you should be documenting that information. So we're going to spend some time on the next couple of slides just reviewing documentation. So by history, you may have been trying to figure out, because as a patient is to be screened once per calendar year, you might be wondering, when they come in, you're having to search through the chart or wondering how or where to find, when the last screening was. Moving forward, so beginning today, as you are watching this recording, moving forward, you should begin labeling every encounter that when a screening is completed, you want to label it SBIRT completed. And we will go over a screenshot on upcoming slides on how to do that. But the purpose and value in labeling the encounter is going to allow you to quickly identify when the last screening was conducted to determine if screening is necessary during this visit. And many of you have been incredibly persistent in digging through the charts and dedicating time, but that's really cumbersome for you. And so this is going to help to quickly course correct and make that much easier for you and your colleagues moving forward. So, if I were your patient and I were being seen today and you completed my SBIRT screening today, you would simply mark SBIRT completed in my encounter label. And then if I come back next month, you're already looking at my list of encounters as part of your, care to me that day. And it would be very easy to see SBIRT completed as part of my encounter label. And you would then simply know that I wouldn't need to be screened again next time. If you are unsure at this point if a patient was screened, sometime this year, you do have the option of, still going back and looking through, as you have been doing through whatever practice, to figure out if they've been screened already, or you could simply, just administer the screening again. Sometimes the time at which it takes to search past encounters can be a bit cumbersome, and so it's sometimes better to just start fresh. With today is a new day, and you just administer the screening again. It does not hurt anything for that screening to be completed again. And then again, you would mark today's encounter as SBIRT completed and move forward from there. So on this slide, you have steps 1 and 2 of the labeling encounter workflow. So you can see in step 1, you're going to right click on the encounter. And that is then going to open a box where you can see in step 2, you have the opportunity to click once on encounter description / remark. From there, step 3, you are going to have a box that populates, and you are going to type SBIRT completed in the box and then click OK. And then from there in step 4, you can see where we have a completed title there in the label, and the encounter label. And so again, looking back, moving forward, you would be able to see SBIRT completed very easily, when you're trying to determine whether a patient is eligible for screening or not moving forward. This is just a refresher on where the screening results are to be entered, or responses. And so you go to the screening section of the SBIRT template, and you will click on screening. From there, you're going to click independently on the audit C, and then separately the DAST, and of course the PHQ-2, but today we're specifically talking about the audit C and the DAST. This is a screenshot of the audit C. This is reflective of the questions we talked about earlier. I will say, though, that this question 2 does not reflect the updated language of on a typical day when you are drinking. And that language was recently updated and is available now in your system. So again, you will enter the patient's responses, and then you click OK. For the drug questions, you have the 2 drug questions, and you will answer either yes or no, and then hit save and close. So as a reminder, patients are to be screened at least once per calendar year, regardless of the visit type. The SBIRT template is where the data pulls from and where all screening responses should be entered into the screening portion. And when screening has been completed, the encounter must be labeled. My information is here on this slide. I am Dawn Brown with the Mosaic Group, and you can reach me using the phone number or email on this slide, and also to Shauna Edmondson with Clinical Associates is an excellent contact as it relates to SBIRT and may be able to answer your question directly or direct you to me if necessary. Thank you.